As a medical negligence specialist, I see many cases where people have undergone amputations as a result of poor medical treatment. Sometimes the amputation could have been avoided altogether, and on other occasions the amputation could have been less severe had appropriate or more prompt medical treatment been provided. I'd like today to tell you about some common clinical scenarios which can result in an amputation. One common example is the misdiagnosis or failure to treat diabetes. I have personally been involved with a case whereby my client had diabetes which went undiagnosed for a number of years, despite his regular attendances at his GP surgery exhibiting many of the common symptoms associated with diabetes. As a result, he did not receive appropriate foot checks and the correct precautions were not taken when he developed an ulcer on his heel. Unfortunately, because of this, he required an amputation of the lower leg, which could have been avoided had he received appropriate and timely treatment. Another example is the misdiagnosis or late diagnosis of vascular disease. This is a disease affecting the arteries and veins which can, if left untreated, cause a loss of blood supply to the organs and muscles leading to amputation. The legs are most commonly affected by this disease, and over time people with the condition can often experience pain on walking, ulceration or infection in their lower limbs. Unfortunately, these symptoms can sometimes go undiagnosed or they are diagnosed late, meaning that the opportunity for appropriate treatment is lost and a potentially avoidable amputation is required. Finally, amputations are sometimes required due to surgical error. Often referred to as a never event by the NHS, removal of the wrong body part should definitely not occur, but sadly mistakes such as this do happen. An example of this would be the amputation of the wrong toe, finger or even the wrong leg. Another example of surgical error is where too severe an amputation is performed, such as carrying out an above knee amputation when only a below knee amputation was required. We have a team of specialist solicitors who are very experienced in dealing with amputation cases. Our team will work with you to help you regain as much independence as possible. Our experts are able to advise on the best type of prosthetics, wheelchair and equipment available to enable you to meet your own individual needs and goals, whether that be mobilising independently around the home, returning to employment or enjoying hobbies such as swimming, running and cycling. We will also investigate and claim the cost of any rehabilitation, which is no doubt key to your recovery. This includes any care and assistance, physiotherapy, occupational therapy or psychology inputs that you may require both now and in the future. In some cases, we can assist you by obtaining an early payment of compensation to ensure that you are able to access the treatment and rehabilitation that you need before your case is concluded. And in some cases we can also help you locate and appoint a case manager to assist you in putting in place your rehabilitation and treatment needs, taking the stress away from you.